Tala Falada and Maloe Lele. Hello and welcome. I'm Adele Gauthier, Research Manager at Breast Cancer Foundation New Zealand. Today we're talking about Pacific women and breast cancer. First, we'll open in prayer.
Heavenly Father, we just want to thank you for this time together. We thank you that you know about this meeting. You know about all our lovely women out there. Father, for everybody that's tuning in, we just pray for your blessing and your guidance. In Jesus' name, amen.
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 Thank you, Mama. So why a webinar for Pacific women? Well, every year, nearly 200 Pacific women in New Zealand are diagnosed with breast cancer. But the good news is, when breast cancer is found early, it's very treatable. So tonight we're talking about what some of those treatments are, some things that might help you get through a breast cancer diagnosis and treatment, and that includes the role of the Pacific nurse specialist. As you can see, we have quite a group of people here tonight, so I'm going to let them introduce themselves. So,
Tala Falada, Malo Soifua, o te umawa maua maile nei Brokalanda, whakatai lava mo le awanoa. My name is Sulu Samuel, and I'm from Waitemata District Health Board, and I work at Waitakere and North Shore Hospital.
Malo Lele, my name is Kolini Ma'afu. I am a mother and of 4 boys and a lovely, amazing husband.
E talo falava malo lele ka whakalo falai atu. I'm Longa Crichton. I'm twice survivor of breast cancer. Thank you.
Tala Falada, Malo Lele. My name is Marian Heather. I'm a GP working out at South Seas Healthcare in Otara. I guess the other thing is I have a mum that was diagnosed with breast cancer, and she went through treatment many years ago, and she's a survivor. She's 81 years old, so I guess this is why this is important to have this conversation. Thank you.
Tala Falada, Malawelele, Kia ora. My name is Karina. I'm a breast cancer nurse specialist at Counties Manukau Health.
great, thank you, and welcome to all you at home too. So we'll get started. We're going to talk first up to Longa and Kalini, a little bit about when they were diagnosed with breast cancer, their personal story. Longa, so how old were you when you were diagnosed, and how was your breast cancer found?
I was my first, as I said, I'm twice survivor. The first cancer was when I was 32, 1991. It was just a month after my youngest son passed away, and I thought it was milk glands as being, having a baby, and so went through some tests, and of course, much to my dismay, I thought breast cancer was just something you read about it. So yeah, I had it, and then the surgery was in February 1992.
So that was the
first one.
Yeah.
And then when I was 52, 20 years later, the cancer came back very aggressive.
And Kalini, how about you? Was that a similar experience, or?
My journey with breast cancer started in 2019 November. That's when I felt regular pain on my left chest. Leads for me to go and see my GP. Never in a million years thought that I'll be diagnosed at a very young age. So my GP, that's when she found the lump with a really hard onto my left breast. So we found the lump there. She urgently referred me to the North Shore Breast Clinic. And then from there, March last year, mammogram, ultrasound, lead to biopsy. And I was diagnosed last year, 17th of March. That's when I received this horrible news about cancer.
Marianne, is it people like Kolini found a lump, as young women sometimes do, and they would normally come to their GP? What happens then?
Yes, so often the woman will come to us, and maybe something like that, like what Kolini said, just maybe a pain or a lump. So what we do from then is we'll check them and we'll probably do a referral to the breast clinic, and they'll do all the investigations and work out from there.
So as you say, Colleen, a real shock at a young age and at any age to have a diagnosis of cancer. How did you feel?
When I've heard the result that you've got breast cancer, it was like at that moment my whole life stopped. It was like that was my sentence for life. Very horrible. Everything around you stopped, dark cloud, and things progressed quickly in my mind. How bad it is. How bad is it? What they found, and am I going to die? Because hearing that word cancer, it's very ugly, and every woman takes this differently. But for me personally, it was like that's my life sentence.
Longa, how about you when you heard that news the first time?
When I heard it the first time, I think denial was probably the first thing that came in mind, thinking you only read about those things, it only happened to people out there. And then throughout the test and a further test, my husband had stayed home to go with me, but I kind of said, no, I'm all right, it's just one of those. But yeah, it was numb at first and denial.
And so did you tell your family? How did you say to them?
No, not at first. I think it was the thinking of I didn't want to worry them, but eventually my husband did ring my family around, my brothers and my sisters. Even my brother in Australia at the time wanted to come for the surgery, because I know that Samoan, when they have surgeries back in the days, they all gather, and I thought, no, there's no need for that, So eventually they all wanted to be there, but my kids were very young. Like I said, I've just had lost my 1 month old, so the youngest one at the time was just over 3 years, not even 3 years, so very young children.
And Colleen, did you tell your family?
So when we got the news, my husband was with me, and stepping out from North Shore Hospital on that day, it was just like our mouths were both heavy. We could not say a word to each other. Of course, there were tears. And then when light comes, I finally slowly digest this news, this horrible news that I've received very young. Now it's the way of how I'm going to deliver this to my 4 amazing boys that I love so much, and my mother-in-law, and the ones that are close to me that I loved. And it was so hard that my mum is not here. And that was the hardest thing for me, like, how am I going to say this to my mum? She's not in front of me, but she's back at home in Tonga. So when finally things comes, I get myself together. I said, okay, me and my husband talk. We're going to sit our boys down. We're going to let them know. It's like Pacific Island people, we're close-knitted, as Longa said. No matter how horrible the news is, and everybody is different, but this is me. I get my family involved, my husband, my boys. The oldest is 17, 15, and I've got a 10 and an 8-year-old. I sit them down, and with the help of Breast Cancer Foundation, they mailed me a book about breast cancer. So we set them down, and I had to be strong, telling them about the news. And I said, because in my mind, this is for me personally, everyone is different. Cancer comes to destroy. Cancer is so horrible, just comes to invade, to steal, to rob. And that was the main thing for me and my family. Sitting my boys down, I said, we're not going to let this bring us down. We're going to walk through this, and at the end, something positive for all of us. So I explained to my boys what I'm going through. And of course, there were questions on their mind as well. Mum, are you going to die? It was not a very good scene, not a happy moment, but we were there all together. My husband, my 4 boys, my mother-in-law. That was done, delivering the news to my boys. They had their own moment. We all went through this together, trying to be strong to each other. The hard part, like nearly had a heart attack, how to tell this to my mum, not having her in front of me, oceans far away from me, delivering the news to her. We had our cries, we had our sharing, but at the end, we have to accept. But do not fall down with this news, but get up and carry on and fight. So we're not going to let cancer. That's how we share the news to my family and my friends, the people that I want to share it to. Don't make me special. And leave cancer out. I'm not, yeah.
So Sulu, you are often involved with people at the early time when they're told they have cancer. Are there different ways that people like to talk to their families, like we've heard here, and do you get involved in that?
Thank you. Hearing Longa and hearing Kolini, I think the fair thing to say is that everybody's different. And in hearing Longa and Kolini, it sounds like even though they heard the news and it was quite shocking and all that, but there are other, some of you will probably not cope as well as Longa and Kolini, and that's where I come in, and that's where the nurses and those work in the hospital come in supporting you, because some of the women will come and they don't want their family to know. They don't want even their husband. They don't want to know yet. They don't want them to know yet. So that's where we come in, myself and the other nurses supporting them, and more or less helping you so that there will be a time, there will be a time that you will be ready for your family, for anybody else to know what you're going through or what your diagnosis is. And sometimes, quite often, you come on the very first day or the very first appointment not knowing what to expect. And then to hear that you've got cancer and not having your family around, that's when we come around, we support and advise that we can arrange for you for a next appointment and then for your family to come in if that's what you want next time. So it's actually to support you and give you the information and actually to make you a little more calmer, so that and letting you know that we're there to help you.
Thank you, Sulu. And it must quite often be, as Kolini said, you have family back in the islands that you need to tell as well.
When that happens sometimes, like I said, that's when we say that you can always have the option of asking to come back again, and then to give others the information that they need, and also give you time to take the information that's just been given to you at that time.
So, Karina, once someone gets into the hospital system, there's quite a lot of people involved in looking after breast cancer. Can you tell us about who some of those people are, what they do?
Sure. Thank you very much for sharing, Laura and Kolini. It's really good for people at home to hear that breast cancer is a very distressing diagnosis to have. And that's why we have an excellent team of support people right behind you all the way. My role is I'm a nurse who looks after people right from diagnosis through their treatment and afterwards, providing supportive care and identifying distress and helping access support for that, coordinating and liaising with other members of the team, educating and explaining and reinforcing. And I get to be on the end of the line anytime anyone has a problem, which I love. So I have a lot of connection with my ladies. It's great. And I belong as part of a multidisciplinary team. So there's also radiology doctors that do the mammograms and ultrasound scans and biopsies on our patients, and the surgical team who initially would receive that referral to begin with and either a lump that's been referred by a GP or another symptom, or a screen detected cancer, and discuss results and treatment options. And pathology doctors that look under the microscope to work out exactly what the cancer is. Oncology doctors that are based at Auckland Hospital for us, who medical oncologists treat cancer with medicine, chemotherapy and hormone tablets, and the radiation oncologists use radiotherapy. So there's a big team, and we get together every week through a multidisciplinary meeting and have a big conference about each patient and where they're at. And so any decisions that we make for our patients are together.
Great.
Yeah.
So making those decisions, having conversations with doctors, how easy is that? So are there some ways for advice for people on how to talk to their doctors and so on?
I think for Pacific women, what we find that a lot of time, or the first times, it's usually they don't get all the information that we feel that it's been given to them. So what we normally do, or what I do, is that I work along the nurses in the clinic, the nurses in the breast clinic or the breast team, and so it's liaising with them so that I can support the women or those with breast cancer, and so that I know when they ring in for whatever information, whatever they need, that I can provide the information that they want, working together with the nurses and the doctors and all of them in the team, because I find that sometimes that we need to give them or we need to give you some information or some education about the medications that you're on, or even some of the treatment, or all those things that I work together with the nurses and breast team, so that the information, the education, and whatever is needed is provided for you.
Great. That's good. That's extremely helpful for people, I'm sure. But Marianne, you must also get questions from people about what they're hearing at the hospital. How can you help them?
I think the main thing is, what Colleen and Long have shared, it's having the family there to support. So, this is a journey that you go through together, but with the family support. And I think for all of us, we're part of the team on that journey. And so we will do everything we can to make sure that they understand. So we have translators. If you need to have a translator, we have resources in Samoan, I think Tongan, some other Pacific languages. So, we just want to make sure that the information gets there, that they're comfortable, and they're comfortable to talk to us about it. But any one of us on the team are happy to help, happy to talk and take questions.
Great. So moving on to treatment and having to make decisions and choices about that, Longa, can you just tell us what treatments you had, and did you decide to take everything that you were offered?
With my first cancer, I was advised to remove my breast, my right breast that was affected. But I think I'm grateful for the education here in New Zealand anyways, that I was able to say, hey, can we take this information, sleep on it, and then come back, which they allow us a few days. So we came back, and my husband and I've decided that I'll remove what was affected. It's just a thought of 32-year-old with children waking up with one breast was not my ideal of, treatment at the time, although it could have helped. So they had the radiation, remove the affected, but then I had to go through the radiation and the full-on chemo. So it was very dramatic because, I think the side effects and all, I think I was very sick through, especially the first cancer. Lost my hair, so it was amazing that I had a really good support of my church family and my family, of course, like looking back, because they realized that I've just lost a child. There were food being delivered and, you know, stuff. The help was offered for my children who were young at the time. And yeah, I couldn't thank those people enough for coming through so that my husband and I can concentrate on my treatment, where he had to take time off work to take me. I think with radiation at the time, he had to be there by 7 o'clock in the morning, travelling from Henderson to the oncology, you know, so it was a lot of, it didn't just affect me, it affected my whole family. Yeah.
Kalini, did you have the same kinds of treatments as Lorna?
So for my treatment, on the day when I received the news, Dr. Eva Hiwas was my surgeon, breast surgeon. So she said, this is what we're going to do. And we're just going to remove the lump and a few lymph nodes. And thank God that there were 9 lymph nodes taken. They all came back negative. So from there, after surgery, they said, while recovering, I will be hearing from my oncology doctor, which is an amazing oncology doctor by the name of Dr. Sheraton Wilson. And yeah, so I had my surgery during lockdown, and it was not a good time. But as a mum, if we can, and all us women, we're all special, if we can manage labour pain, I strongly believe that we can fight anything. So after surgery, during my recovery, got the phone call from my oncology doctor, and we had a good chat on the phone. And this is what they said with the cancer that we found. So this is the planned treatment that you're going to go through: chemo, radiation, and then 5-year hormone therapy. So it was a good chance at that time. You have all the time to ask questions. But before that, I did some research on my own, find about horrible chemo, radiation, read through, good read with videos of women who went through the same treatment as I go through. Sounds scary, not a good feeling at all. I don't have the right word to describe but all I know is that ahead of me, I'm going to go through chemo, radiation, and 5 years of hormonal therapy, and hearing all the side effects, like I just broke into pieces. That's honestly how I felt with the horrible. What comes to mind was how come that this chemo, radiation, and 5-year hormone therapy, it's a treatment, is to kick cancer out of my system. But at the same time, it's so harsh and horrible, going through hair loss and everything. So the decision with my treatment, I asked my oncology, so do you think this is the best treatment for me? They gave me time to discuss with my husband, and with my faith in God, and with my husband, my Superman. And my oncology came back to me and said, so what are your thoughts? Discuss and everything like that. And I said, yep, let's do it. So let's go forward. I know this is horrible, terrible, and whatever I'll go through, I don't even know what's the road ahead of me, because every woman is different. Every woman have their own side effect, and we have our own way of fighting this. So going through treatment, especially chemo, and with having 4 boys, you love life. You get up, you know, you're always on the go. I always, going through chemo, I always said to myself, a 90-year-old is healthy and active, and here am I, just like that, you know, missing. That's one thing. In tears, I have to be honest, you cry. If you have to cry, you cry. That is the part of me going through this. And my 4 boys was my energy to fight, to carry on. During chemo, I had my bad days. But seeing your family and your loved one and your boys, it gives you that kind of extra strength and courage to fight. Don't give up. We all especially the lovely women are watching from home. It's a terrible time, but we do it for our loved ones.
And long
And we're so lucky. For us Pacific women, we're very lucky to be here in New Zealand. We have got variety of supports to be there, like Karina and Sulu here, Breast Cancer Foundation. We're not alone in this. Reach out. There are a lot of help and support out there. But for me personally, it was my family and my faith in God that get me through this horrible chemo, the tiredness of everyday radiation, and I'm now currently on my 5-year hormone therapy, and I'm on exemestane and Solatex. So keep fighting, don't give up.
Thank you. So, and Longa, you found the chemo really, really hard too, didn't you?
Yes, I did. I went in with the mindset that I may be down, but I'm not out. And I've had a lot of people telling me, women that have gone through their experience, but I said to my husband, we're going to go through this. Everybody's different, as Colleen is saying. I'm just going to take it as it comes, however it is. We'll cross that bridge when it comes. So when it did come, it wasn't nice for me. I lost all my hair. So this, I'm talking about the worst of the treatment was on my first cancer. Yeah.
Right. Yeah.
And then 20 years later, when it came again, very aggressive. And it was, I think it was life-threatening, the second one. Fortunately for me, I think I walk my faith in God that I do what I can when I can, because when I can't, I can't. And so I was working for the whānau at the time, and my doctor, I want to acknowledge her, an amazing Dr. Londine. She was right there, guiding. She was, I think, more of my bunch bag, and she just, lovingly guiding me through the treatment and the decisions that I had to make. And but the first chemo that I did for the second one, they put this podcast on me, which didn't work. 4 out of 5 times it didn't work. So it was like, you go through that sort of thing, and then for whatever reason, so that was an extra on my second cancer. But I thought, at the time, my life is still in God's hands. My last breath is in His hands, and come what may, by then my children were old enough to say to my friends and families that wanted to take me to all my appointments, thanks but no thanks, this is our time.
Oh, nice.
This is our turn to take Mum and support her. So I really want to acknowledge them, because even right now, they put me on a 5-year therapy. Even that, it didn't work down for me. The side effects of those tablets that they gave was really horrendous. I get spasm on top of my top half while I was taking those. And so I would go to work and I'll have a meeting and I could feel me starting sweating, side effects of the, and then I would slowly make my way out and then go home, So I really acknowledge the support that the whānau had given me, because I had done as much as I can at work, but the rest was when allowing me to take that time out. So I think it was only, they say 5 years. From that second cancer, they requested, they advised that I should go for a genetic test, because of, I had cervical cancer in 1989 when I was pregnant with my 4th child, and then there's 2 cancers coming, So I thought, why not? I'll do it for my children, and I'll do it. So I did. Unfortunately for me, again, it came as, I have had the BRCA1. I've got the BRCA1. they say that I've got 87% of the cancer coming back. And so once again, that's kind of, I thought, wow.
So, I think that talking about the BRCA gene, I meant to ask at the start if you had any breast cancer in your family, and so you had.
I had not encountered anybody of my family with breast cancer. I would be the very first one. I knew my mum died of stomach cancer. So when you're young, that's what you were told, and that's what you knew. Unfortunately, when I went through the genetic test, it said that my mum died of ovarian cancer.
Which is with the BRCA gene. Marianne, how many people have a mutation like the BRCA gene?
Less than 1%.
So it is quite small. Kalini, did other people in your family have breast cancer?
Yeah, my mum's side, that's where I think I've passed me down. So my mum's side family, that's where I've known breast cancer.
So thinking about these treatments that you've had, although different people experience them a bit differently, they are really, really tough. Karina, why do we have these treatments? Why do we have to go through this? Can you just tell us a bit more about what they actually do?
Yes, sure. So yes, as you can hear, the treatments are different depending on the type of cancer that a patient has, and the age and the health status of a woman as well. There's three main treatments we have for breast cancer, and the first would be surgery and radiotherapy and chemotherapy and hormone therapy comes under medicine. So depending on the size of the cancer, how fast it's growing, so what grade it is, you might hear your doctor or nurse talking about the grade, if it's invasive or pre-invasive, or if it's spread to the lymph nodes or not. All of those factors get discussed in the context of that person, so we can work out exactly what treatment is required. And the treatments are hard, they're hard. They're surgery and chemotherapy, and your body image can be altered. As a woman, that's hard. You feel unwell with the treatments, but there's a lot of excellent support out there to help with that as well.
So the surgery takes the cancer out?
So yes, the surgery is designed to take the cancer away, either by a small operation to remove the cancer with a rim of healthy tissue as well, if the cancer is small enough. If the cancer is larger, then it would be recommended that someone would have a complete removal of their breast, with or without reconstruction, depending on the parameters and the criteria. And that is done usually first, but sometimes, depending on those other factors I mentioned, people may need chemotherapy first.
That's what Kalini did.
Right. So, and that would be to give a strong medicine that goes directly into the vein to go around the body and hopefully mop up any cancer cells that could already be circulating around and shrink the cancer in the breast as well to make surgery a bit more easy.
And what is the radiation?
The radiotherapy is like a very strong X-ray beam delivered over a period of days. And it's quite hard to imagine because you can't see it or feel it. You go along for your appointment, you're there for, takes ages to get a park and get changed, and, and then you're lying down and the radiotherapy machine beams from one side to the other. And it's like having an X-ray, I guess. It feels a bit like that. You don't feel anything, but what it's doing is quick. It only takes minutes, and then you're off again, and you come back the next day. And usually it's about Groundhog Day. Usually about 3 to 5 weeks every working day. And what it does is it damages the cells locally to help prevent the cancer coming back where it is.
Right. And what about so people have talked about the side effects and so on. So sometimes people use complementary or traditional therapies. Sulu, have you got some thoughts about what other things people do to help them get through the treatment?
Oh,
can I pass that question?
Yeah, sure. Yeah. Did you ladies use anything else? Any sort of natural things alongside your treatment?
No, not for me.
We have people asking about complementary therapies, and you might too, Marianne. And often our advice is we love it when people tell us, you know, because we offer medical treatment, but we know that other treatments we want to try as well can often be done at the same time, as long as we know that it's not going to affect any of the other treatments that people are having. So yes, we're all on board with that.
Great, great. And I think there are some things like massage and things like that people can find helpful.
Yeah, some traditional therapies like massage.
And of course prayer and church.
Yeah.
And so on, So thinking about the supportive services you have access to in the hospital, Sulu, what kind of help can you get with directing people to counselling or social support and that kind of thing?
Okay, I'll try and answer.
Or if people need a translator, do you connect with them?
I think before I go on or before I answer the questions, I just want to more or less say that I'd like to take this opportunity to actually say more about my role at the DHB. It's that I am the clinical nurse specialist Pacific, and I support with coordinating of support, and not only support, but the role also educate and provide whatever's needed for the woman. And saying that, when we know of patients or how we get to know the woman that are either for investigation or that they've been diagnosed with cancer, I mean, there are reports, there are referrals that come to where we work in the cancer service. So that's how we get to know the women that come to the hospital. And what I like to share today is that most of the Samoans who needed the support, it's good because I'm Samoan, but there are Tongans, there are other Pacific Islanders that I cannot speak their language. So it's really good that we get to know them before their first treatment or before their first appointment, so that we can let them know of what's available there for them. Not only that I'm Samoa that speaks Samoa, but we got other, other staff like Tongan nurses that can speak Tongan, and then we have interpreters that we've mentioned, and then we have chaplains who are Tongan, who speaks Tongan, and we have Cook Islands in the Pacific service. So it's, I will be the first one, if ever, that they will meet, but we've got other people that can help or that can support. So I will be the first person or the main contact, but then there are other people that I will let them know or that they need to know that can support them.
Great.
And sorry, get back to the question. What was the question?
No, you're pretty much answering it.
And I think, and also in the cancer service, we've got psychologists, we've got social workers, and then we've got nurse specialists. I mean, there's quite a few of us in many different cancer services. I mean, we're talking about breast cancer, but the service has those for specialised in lung cancer, hematology cancer, and so many others. So for me, I'm not only working with breast nurses, but I'm also working with all those other cancer services. So I think that's one thing I want to let the people who are listening know, that I'm not only with the breast cancer service, I'm also with the other, but I'm the only Pacific person that's actually working with all of those. So just the person to coordinate and work with them.
And I think it's probably a good time to point out that nearly all the DHBs around the country, all the hospitals do have a Pacific.
No.
Okay, so you should ask if your hospital has one. If you haven't been put in touch with a Pacific nurse, then find it, you can ask to be referred.
A good GP is a good place to go to direct you in the right place, isn't it? If you don't, if you can't access those services, then there will definitely be support out there. It might just be in a different form, and GPs seem to know the right places to go as well.
Yeah, so you're connecting people in, Marianne?
Yes, we do. I mean, I guess that's a good thing because we know our patients very well, and also too we know what's in the area in terms of support. So if we are not sure, we will always find out.
Oh, great. Yeah, excellent. Yeah, so really important to have a good relationship with your GP, it seems. Yeah.
They know your history and record and everything.
And your family.
And in terms of other supportive things, Longa, you do some work with the whānau, don't you, out in Auckland? And what kind of support do they offer?
I know the whānau has got an amazing workers who, under their screen, that they go and pick women up for their mammogram. And I think I've ever accessed them for many women, and also vice versa. If they come across women who in that fearful first stage of don't want to go through it, they would bring me and I would support them, because sometimes your own personal journey can, say, hey, it's not as scary. And my advice to women even now is the fact that when I had my first cancer, it's been quite advanced as far as we've got some amazing doctors out there that are doing, the actual surgeons and all that now than when 20 odd years, 30 years ago when I first had it. So I think the support out there, I'd say the whānau, they have all sorts of islands, different Tuvalu, Tongan, Fijian. So I think if you definitely, your GP, your Pacific provider would liaise with you.
Great. And certainly in some parts of the country, the Cancer Society will provide transport to treatment, and organisations like Breast Cancer Foundation, we provide rehab after surgery and counselling and other services. The hospitals are all supposed to have psychology services, so if you haven't been referred and you want to be, you can ask about that. We will get in touch in the next couple of days. We'll just send you a list of some of the services that are available, and you can also call our nurses to ask some more about that. So there's a couple of other things that we've got a few questions to deal with, so we'll cover a few more things there. But before we move on to that, Longa, can you just tell me what is life like for you today after breast cancer?
Well, life with me, I'm still living with side effects of the cancer. I've got lymphedema because they removed all my lymph nodes. So there is this hand is just basically nothing. It's, I can't even carry my bag, let alone my umbrella, fire holder. I don't know how many classes I've broken because it's loose, the strength of it. And so the nerve pain I'm living with that. So if you ask I take it now, it's my life, because the chronic pain of it comes when I'm least expected. And so life with cancer is that, like I said before, I may be down, but I'm not out. I'm grateful to be alive. I'm grateful to see my children and my grandchildren. And anything I do for my life now, for my health, is more for my kids. And I think if some of them are watching, they're probably eye-rolling now. But it's every day is special. Every day is when I put my foot on the floor, I know I'm alive. and doing what I can, go for walks, and it's just basically really looking after. And I think, can I just mention also for our Pacific women who sometimes don't utilise all the support that are given to us, and this is going back to utilising look good, feel good. That is, yeah. And the breast, where are the, I forgot the names of the, yes. So it's really important that you access those support. And if you in doubt and you don't know where to go, I think the team here can give you our numbers anyway. I'm more than happy to come and support you, take you through that process. So I think we're just in just a phone call away. That's all I'm saying. You know, you're not alone. This journey is, we're all in it together. We're all in it together.
That's wonderful. Thank you. I'm sure your kids are watching and very proud of you, not rolling their eyes at all. Helene, where would you say you're at today? How are you?
I just want to acknowledge our lovely women viewing from home. Every woman is different. For me, life after cancer, from the very first day, I won't lie, it is hard. But individually, you have the choice with the strength, with your loved ones surrounding you. So for me, life after cancer, I would say I've come out from this storm, horrible journey, stronger and beautiful. I come out from this journey not empty-handed. Even though cancer comes, this is my war. Everybody's got its own war. And my war with cancer, that I make sure that this horrible disease does not come and steal and rob you away. You're beautiful is how God created us beautiful women to be. Don't let cancer destroy you. I know it is hard, and every woman has its own way of processing this. But for me, I had to personally make sure that I don't come out from this empty-handed. Let this horrible suffering that you go through, you come out at the other end stronger, beautiful, and like Longa, I'm ready. I'm out there wanting to help women who are scared, who my ears are here to listen. But for me, coming out of this very positive, I make sure that I don't complete my journey with cancer, wherever it's leading me to, that I won't let cancer win. Don't let it destroy you. That's me, life after cancer. I'm happy. I'm back to full-time work. I'm back to running around with my 4 boys, which I love so dearly. And I am doing this for my boys to grow old, to have grey hair, to watch them be a good man in the future. And I have a lot of dream. Don't give up. You know, that's for me. Don't give up and don't bow down to cancer. Come out in this strong. You are not alone. I am not alone. We are all in this together, like how our beautiful team here, we are very blessed and lucky to be here in Aotearoa. There's a lot of services available for us women. Sulu is here, I'm here. Longa is here, Marianne, Karina, Adele, and Breast Cancer Foundation is here. Reach out. It is hard. Reach out. You're not alone. We're all in this together. But for me, in my journey, I will not bow down to cancer. I will not give up. I'll fight on until the end. I come out from this not empty-handed. My bucket is full. My bucket is full of positive. Stay positive. We are diagnosed at different stage of cancer. Some are very lucky, some may not be, and I'm so sorry to bring this up. But don't give up. Just keep fighting until the end. enjoy, live every life to its full, and just listen to your body and just do what's best. You are the main doctor to you. Listen to yourself. Learn to say no, learn to say yes. Reach out if you need help. My number, my contact, I give permission to Adele here. If you just wish for a friend to go out for a coffee, have a laugh, have a cry, got any question, I'm here. And I'm so happy. I think God has put me in this journey to reach out and help other women, Pacific Island women.
Seems like that with both of you.
So, but life after cancer, to cut, sorry. Life for me after cancer, I'm happy. I come out as a beautiful butterfly and stronger.
Great, thank you. Thank you so much. We've got some questions from people at home, so let's just move on to them and get through them. And I just want to start with one. You can still put a couple more questions in the chat box if you like. We do have a few, but we will have time for them all. So do go ahead if you do have other questions. Now, first up, here's a little question. Apart from the information that you share, so I think this is talking about you, Sulu, and you, Karina, how do you show compassion and empathy? How do you coordinate with cultural differences? I think Sulu, maybe things about how many, bringing family with you to consultations, things like that. Can you tell us, are you allowed to bring people?
I think the other thing that I didn't mention before is the confidentiality that our people, our women, and I think that's part of why they sometimes don't want me at the very beginning. It's the confidentiality, and I think it's a good opportunity now to let the women who are listening that any information that's shared, any information about you, it's kept confidential at the DHB. So information is not shared, so your information is safe. So not because I'm brown and not because I'm Samoa that every Samoa will know about your history. No, I'm there to support, and I'm there for a reason, not for that reason. So be comfortable in sharing your information while I'm there, because knowing your information, I'm also able to help you and help the doctor as well with whatever information that we need to be clear of and clarify.
That's really
And the other thing is, I know from most of our Samoa people, very much Samoa, but then also Tonga, and that you think that when you can't communicate in English, that you think that you haven't been to school, that you're not that good. But the language, the medical language is different. So whether you can speak English or not, it's a different language again. So if you don't understand it, say so. And we're there to help you with that. Like I said, we can get a Tongan person, we can try and get a Fijian, Tokelau, Cook Island and that. But if we can't, then we have access to interpreters. And also interpreters, they do know too that they have to keep everything confidential. So just to make you feel comfortable that we're not to leak out your information, we have to keep that confidential and keep it safe for you.
Thank you, Sulu. That's really helpful and brilliant. And of course, that will apply to any other Pacific nurses around the country. They'll all be under the same privacy and confidentiality, won't they? So that's really, really helpful. Karina, how about you?
Yes, I think with anyone we see, any patient and family, we want to look after people the way they want to be looked after. And I think that's really important. And acknowledging that even though our system has what looks quite limited in terms of being able to embrace other people's differences and cultural identities. For example, we send out an appointment in flexible time. You come into our clinic and there's a long wait, and you come into the clinic room and there's 2 chairs, which suggests that you can only really bring one person for support. But actually, as a team, even though our buildings and the way things are organised may not look like it, we are very much interested in a family a family-based model of care, and I understand for Pacific women that is an important way to make decisions. Both Colleen and Longia talked about your families and how they were involved in your decision making, and for us to be able to provide a place like that where family can be included, we can have ongoing discussions together is really important. And knowing that afterwards, you don't need to make all your decisions at the time with the nurse and doctor in the room. You go home and have a think about things, and we can talk again.
And can you change appointments? If
You
it's not gonna
can,
work
that's
for
right.
you?
And that's the thing, like, even though the letter says in bold, this is your appointment time, and actually there'll be a number on that letter, and you contact us. It's our goal to get you there when you can get there as well. And if you don't attend, we'll ring you and we'll try and work out how we're going to get you there, and try and work in with your employer. We can liaise with employers for you and write letters for support if you need to as well. We want to work around our women.
Yeah, I think there's one thing that comes to my mind. I think we talk about bringing families. We can bring as many as we like, or as many as you like. But in case, we've just had the lockdown.
True. Yes.
And it depends on the situation, because with the lockdown, I know with level 4, there was, cases where women were first informed of their cancer diagnosis, but they were on their own. And I think, sometimes we'll do our best to do as much as is required, but sometimes we just have to think of the situation. I thought it's best to bring that in, because some of our people who might hear say, well, you guys have said that we can bring as many as we like, but times change.
True, right.
And my fault. No, but
Karina said
so in good times, and then we can, say bring everybody, but we'll let you know when the situation changes.
True, yes, I think we've all found that last year.
Become good at our telehealth appointments, right? Being able to include family at home as well when they can't come in.
That's a different thing, because we find with telecommunication, especially when somebody doesn't want somebody at home to hear what's going on.
Interesting,
Some people, like we've said, that they want the whole family to come, they want so many people to hear, but some of them, some women, they come on their own. They just want to be on their own first, and then work their way along. And then we found that with the telephone, that's what happened. We got the feedback that they weren't really ready. They didn't tell those people that were in the house, but then on that, that's what was picked up then.
Right,
Everybody's different.
Yeah, and can be hard, but you need to be able to speak up and say that doesn't work for me.
Yeah, that's right.
If that's the case, even though that's very hard.
Yeah.
Thank you to a couple of people out there who have recommended resources that that are useful for Pacific women. So we will include those in the email that we send out to people in the next couple of days. Thank you very much for that. A question for Marianne. After people have finished their cancer treatment and they end up back with their GP, what happens then?
Well, I think being the family doctor is you're basically there from the beginning right through the journey till after. So we will continue to look after our patients right through. If there's anything they're worried about, any supports they need, anything they're worried about with the cancer, then we can also contact the breast team at the hospital. But our part in looking after patients, it never ends, and we're happy to see anybody. What I would say is, if you're a female watching this, get checked early. If you're worried about anything, even if it's big or small, or if you just want to talk to someone, please come in and see your GP. We're more than happy to see you.
Great, thank you. A question for Karina. What should I bring to my surgery?
Oh, that's a good question. So usually prepare to stay overnight, 1 or 2 nights, sometimes more. And we usually just suggest that women bring in an overnight bag, toiletries, comfortable clothes. Wear a bra if you want to, even after a mastectomy. Some women are comfortable without, other women want to wear a shape under their clothes quite quickly, which we provide a temporary prosthesis for, a softie, and that's okay. We can manage that with drains and things as well. You can bring your own nightgown in if you want to, but I always suggest don't bring a long one that you have to try and hitch up to show your surgical site. It's hard to preserve your dignity that way. Have one that opens up this way, or a top that goes up, or PJs, or use the hospital's gowns. Then you don't have to worry about the laundry, and they're nice and comfortable.
The old pajamas,
that's right.
One, the button in the front.
Great.
With the long pants.
Yeah,
those pajamas.
Yeah, exactly. And bring your phone if you like. We've got Wi-Fi at counties. Other places probably do now. And yeah, just like you're going for a weekend away.
And now a question, is there a group that survivors can go to for support? So that's like after their treatment, positive motivational get-togethers. Did either of you go to groups, or did you?
No, I didn't. However, through the funnel, once again, of course, they often have groups where they ask me to come and share my story. So I have made myself available in that regard, and I do give out my myself. But maybe tonight, if you're watching this and you want to start something up, I'm on your corner.
Yeah. Maybe too soon for you to be going to a group, Kalini, but do you get together with other patients?
Yeah, through Facebook. That's how you'll connect with people. For me, it was through Facebook. There's a group there, and then every now and then us women, we organise to go out for lunch, or so that's breast cancer New Zealand. That's on a Facebook page. Yeah. And
there are, I would mention that Breast Cancer Foundation has an online group, My BC, where people do arrange to meet face to face as well. We'll send you some information about that. Breast Cancer Support is a charity around the country which does organise get-togethers too. So that's something else that's worth looking into. Yeah. Let's see, what else do we have here? Some big thanks from people to you ladies for sharing your stories tonight, and to Sulu and everybody else for their help. Someone is telling us she's helped form a support group in Northland, so you can let us know that and email us that, and we can share that with everybody too. It's really good for us to know about some of these groups as well. Let's see. That's just about all our questions tonight. There is a question about Pacific Island male breast cancer, and I don't know if many Polynesian men do get breast cancer. Do you?
I've heard a few, but I don't know.
Yeah.
Very few.
Yeah, we do acknowledge that it can be much harder for men to get information about breast cancer and feel like they're getting support and to connect with other people in the same situation. But that is something, again, our nurses can help connect you with people on that.
That's right.
Yeah. Great. Okay, well, we are over time just, so we will say goodnight to everyone. I'd just like to say thank you to all our speakers here tonight. So to Sulu and Kalini and Longa and Marianne and Karina, thank you all very much. We thank you all to you at home for watching too. We will, as you leave the webinar, there will be a a little survey for you to fill in. If you wouldn't mind telling us what you thought of the webinar, that would be really helpful for us. And a big thank you to our producer Julia, who you can't see, but who's been running all the technology for us tonight. Julia, have I forgotten anything? No, apparently not. That's good. So good night, everybody, and God bless you all. Bye.
Bye.
Bye.